A very good afternoon to all the viewers. My name is Richa and I welcome you all to We Talk Do You Show, a show by Puberty to Menopause, a public health awareness initiative by Human Biologicals Institute. Human Biologicals Institute, a division of Indian Immunologicals Limited, shaping global healthcare by spearheading the One Health Initiative. The One Health Initiative talks about optimum health of animal, people, and the environment. IIL was established by the National Dairy Development Board (NDDB) in 1982 as its unit and later registered as a company in 1999 with the name Indian Immunologicals Limited. Human Biologicals Institute was established in the year 1998 when the Government of India requested IIL to produce a modern tissue culture anti-rabies vaccine to phase out the unsafe nerve tissue vaccine. The first manufacturing facility of Human Biologicals Institute was established at Ooty. The facility is one of its kind in India to have rolled out first varicose culture rabies vaccine in 2000. Subsequently, Human Biologicals Institute launched other vaccines and currently we are the major player in human vaccines. Leader in ARV segment and present in around 50 countries. Three state-of-the-art manufacturing facilities at Ooty, Gachibowli and Karkapatla, also known as Genome Valley. Human Biologicals Institute has forayed into the market of clinically proven wellness products and infertility range of hormones. While coming to our vision, mission and values, our vision is shaping global healthcare by spearheading the One Health Initiative. Our mission is to innovate, produce, and market quality healthcare products and services to improve and extend lives. While coming to our values, we believe in providing affordable products with high quality through continuous technical innovations and improvements to meet our customers' need. As we know, we are a kind of company who will definitely look after taking care of environment as well. We proudly bring before you the Green Initiative as we have launched our flagship brand anti-rabies vaccine Abharab in an eco-friendly pack, and with this we could reduce 160 tons of plastic per annum. Now, as a company, we don't just manufacture and market products, but Human Biologicals Institute has done a lot in the corporate social responsibility as well. And we have taken up various projects. One such project is adoption of government schools. We have adopted two government schools in Karkapatla facility and totally revamped it and gave private infrastructure to these government schools. And with our intervention, the strength of these two schools have been doubled. Our other program is Gift Milk Program in coordination with NDDB. We are giving additional nutrition supplement to over 1600 school-going children of Telangana and Tamil Nadu. Also, we have facilitated the setup of an oxygen generation plant at Telangana Institute of Medical Sciences, Gachibowli. The unique advantage of this oxygen plant is that it is capable of supplying oxygen to 70 patients at a time. To get more information about Human Biologicals Institute, you can visit www.indimmune.com. Our toll-free number is 1-800-313-999977. You can also follow us on LinkedIn, YouTube, Facebook, Insta, and Twitter. Also, you can go through our unique initiatives on fight against rabies at www.fearlessagainstrabies.com and everything you want to know about women's health at www.pubertytomenopause.com. And with this, today once again, I welcome you all to yet another interesting topic of session and discussion on preterm labor and overview. Preterm labor is nowadays becoming very common, but we don't know exactly what it is and how to identify if it is happening. To make us know in detail about the topic, we have with us a very renowned gynecologist and expert, Dr. Bushra Wasif. I would like to introduce Dr. Bushra to all our audience today. Dr. Bushra Wasif is an enthusiastic young gynecologist presently working as co-director at Zehra Hospital, Bhopal. She is also certified by American College of Obstetrics and Gynecology in high-risk pregnancy, infertility, and endocrinology. She has also done training in laparoscopy. Prior to Zehra Hospital, she was also associated with Ellen Medical College and JK Hospital under Gynecology Department. Also, she has given her services at Bhopal Care Hospital, Avicenna Multispeciality Hospital, also located at Bhopal. A wholehearted welcome to you, Dr. Bushra, on our We Talk Do You session.
Thank you, Richa. Thank you to Human Biologicals and you for this humble introduction.
Thank you so much, ma'am. So, ma'am, we will, without wasting much of our time, we'll start our discussion. So, Dr. Bushra, will you enlighten us and our viewers on the topic itself and why is it so necessary to talk on this?
Sure. Preterm labor is labor which is happening between 22 weeks of pregnancy to 37 weeks of pregnancy. Now, pregnancy as a whole is a 40-week duration. The term gestation is called as 40 weeks, but anywhere between 37 to 40 weeks, we will call a term baby, like a term pregnancy. So, any delivery which is happening between 37 to 40 weeks is normal, but any pregnant labor which initiates, like which starts, any pains or any signs and symptoms which are starting before 37 weeks of gestation, that is called preterm labor. And why is it so important to discuss? Because perinatal morbidity, meaning the number of infants that we lose in the first month of life and the first year of life, is very high. India being a developing country. And preterm labor is one of the major causes of perinatal deaths. So, to ensure that we are cutting down on the numbers, we are trying to prevent any kind of morbidity and mortality in preterm infants. We have to know the topic so that we can fight it better.
Definitely, Dr. Bushra. So, ma'am, shall we start with, kind of understanding more what is preterm labor and when exactly, like you have already told, can you explain it in a better way that when a lady, like we can say, is into the preterm labor?
Sure. Uh, for that, we need to understand what is labor and what are the signs of labor. Labor means the process of giving birth, and it is a gradual process. So it starts with certain signs and symptoms like backache, gradual abdominal pain, most importantly, the opening of the mouth of the uterus, which is called the cervix. So there are two phases in labor of the cervix. One is called opening, which is the dilatation, and one is the thinning out, which is the effacement. Now, any thinning out, that is the effacement, or the opening, that is a dilatation, which is starting before the 37 weeks. And then this is something which the gynecologist is going to find out, right? Whether it is opening up or whether it is getting thinned out. But before that, the patient will start experiencing certain symptoms like a little bit of abdominal pain is okay. It happens in all the pregnancies, but then gradual increase in that abdominal pain, the intensity is increasing, the frequency is increasing, and then it's not subsiding on its own. And then it is increasing to the extent of one contraction per 10 minutes. And the intensity of the contractions goes on increasing. There is backache. So these are certain symptoms which the patient may feel. One more important symptom is vaginal discharge. It could be bloody discharge, it could be excess of fluid. So, any kind of backache, abdominal cramping, which goes on increasing gradually in intensity and frequency, any kind of vaginal discharge which is excessive. All these are kind of red flags which the patient should be looking for, especially before the 37th week of gestation. And then that is actually the signs of preterm labor which the patient should be looking for.
Okay. So, Dr. Bushra, does this pain subsides on its own, or like how it will be?
Okay, speaking about that, there is something called Braxton Hicks contraction. Now, Braxton Hicks contractions are a normal phenomena. Braxton Hicks contractions are the normal contractions of the uterus, which is actually going on throughout pregnancy. So, and that is, it subside on its own. It may happen sometimes, and then it may by some rest or something, it will go away on its own. But as far as preterm labor is concerned, as long as there is no medical as far as there's no medical treatment taken, complete bed rest and proper medical care, this will not subside on its own. Richa, you're not audible.
Ma'am, are you
Yeah,
able to hear
yeah,
me?
yeah.
Yeah, ma'am. Ma'am, I was just asking, what are the risk factors associated with, preterm labor?
That is a very good question, Richa, because knowing the risk factors, we can actually prevent it. So there are certain factors which are preventable, which is related to the socioeconomic status or the age-related factors like pregnancy in less than 18 years of age or more than 40 years of age. Then associated factors like overnutrition or undernutrition, both of which comes under malnutrition. So if there is the patient has a lot of deficiencies of say for example the patient is anemic or having a lot of other deficiencies or is obese, both of them are at high risk of preterm. Then other factors are if there is a substance abuse. Now, being like from our background in the Indian society, usually the mother is not at a substance abuse like smoking or anything, but there is passive smoking in the mother. So these kind of things. And then stress, infection. Now stress can be of any kind, psychological stress, or if there is any infection or inflammation, so that may cause preterm labor. These are the modifiable factors which we can work on. The other factors for preterm labor is if there is some uterine abnormalities. If the patient has any uterine abnormality, she may go into preterm labor or twin gestation because of the expansion of the uterus, more than the time it is expanding. So that may cause, so twins, if the liquor is more, as in the water around the baby is more, which is called polyhydramnios, that may also cause preterm labor. So these are certain factors. Some factors is just for the doctors to understand and take proper steps to avoid, like if the patient has a history of preterm labor, she
Yeah.
is she is at a very high risk to go into preterm labor, and knowing that history, the doctors can give her prophylactic treatment. And then the other factors that I said, like the age, the deficiencies, the malnutrition. So the patient and doctor both, if like in a preconceptional period, like before the patient is getting pregnant, if we inform the patient about all these factors, definitely the patient and the doctor both can work towards this. And then, this taking small steps may help us reduce the number of preterm labors and the cases of preterm births that we are getting.
Very true, Dr. Bushra. If it is identified in well in time, then obviously the complications could be
Definitely,
reduced.
precaution is always better than cure.
Yes. So, Dr. Bushra, how do you diagnose preterm labor clinically? And are there any tests performed or particular tests are there which our audience should know about?
Sure thing, sure thing. See, as I said, that aches and pains are a very common part and parcel of pregnancy, especially abdominal pain and abdominal discomfort. Now, if it is a Braxton Hicks, as I said, sometimes a Braxton Hicks can be so severe that it may give a false sense of labor, which is called false labor. Now, how do we identify and how do we monitor preterm labor, as you said? So, any patient coming up with abdominal pain, cramping, backache, pelvic pain, or pressure, so all these symptoms should not be taken lightly. It should be monitored. And most important things to be monitored in preterm labor are how is the frequency and intensity of the pain increasing. Then, as I said, another thing is that when a obstetrician does an internal examination, we come to know two things about the mouth of the uterus. The mouth of the uterus is called cervix, and there are two things which is to be seen. One is the opening and one is the thinning out. Opening is the dilatation, thinning out is the effacement. So for example, if I get a patient today and say she's 34 or 35 weeks, and I checked her now, and she's complaining of abdominal pain on and off, and we are giving her medications, we are trying to stop the labor, and then again after 6, 8, or maybe 12, 24 hours I check, and there is a very serial, as in the opening of the cervix is going on continuously, the thinning out of the cervix is going on. So that is how we monitor and we diagnose preterm labor, that yes, she is in preterm labor. So this is one part, is physical examination. There are some tests as well. For example, with sonography we see the length of the cervix. The cervix is the mouth of the uterus. Now looking for the length of the cervix gradually, if it is more than 35 meaning 3.5 centimeter, it's a good length to to have a little bit time for continuing pregnancy. But if that length is continually decreasing, or to begin with, when the patient shows up that length is say about less than 25 like 2.5 centimeter, then that patient is at high risk for preterm labor. There are some other tests as well, like when I'm doing an internal examination, some kind of fluid or mucus is going to come on my fingers. That thing is also tested. Initially it was tested for fetal fibronectin, but then now that fetal fibronectin, it is supposedly it can be increased only through checking as well. So there are now newer molecules like placental alpha microglobulin 1, PAMG1. The test is called Partosure test or amniosure test, depending on where you stay. It has different names. So that is also a molecule, the presence of which, like if I'm doing an internal examination and some fluid comes on my finger, and that thing is tested, it is sent like on a slide and tested, and if that PAMG1 protein is found to be present in that, then the chances of the patient delivering preterm is pretty high. So we are, like, as a Society of Gynecology and Obstetrics internationally and also in India, a lot is going on, a lot of work is being done in this field itself to make sure whether we are diagnosing the preterm labor on time and diagnosing it right. Sometimes it may be just pains which will subside, which will go away, but sometimes it is like for sure that the patient is progressing. So identifying such cases is important, and these are few tests that we perform to know whether the patient is actually progressing towards labor.
Thank you so much, Dr. Bushra, for letting us know about all the tests in so much of detail. It will be really helpful even for the upcoming gynecologists as well. Dr. Bushra, now if a preterm labor is happening and a preterm birth is happening, so what all complications could be found at the child part or the newborn part? And we would really like to know that.
Definitely. Now, since we are discussing so much, we have to know that what is it that is persuading us so much to know about preterm labor to act on time. So the point here is that the development of a baby, getting completed at 37 weeks, happens in phases. Now, definitely, when a baby is coming before term, there will be some problems, and the most important and most common problem that we face is respiratory distress, meaning the lungs are not as in strong enough to have that respiratory system working on its own. So the baby goes into respiratory distress. Low birth weight is another challenge. Definitely the premature baby is more exposed, as in more chances of getting infections, different kind of infections, and landing up in say sepsis. NICU admissions are increased. Intubation and putting the baby on ventilator is increased. So respiratory distress is one thing. There are other few things also, like there is retinopathy of prematurity, like the eyes, we have retina in the eyes. So there is this specific condition called retinopathy of prematurity, which is found more in the premature infants. There is something called necrotizing enterocolitis. Necrotizing enterocolitis is a problem, as in it is an infection of the intestines. So that is also one of the complications which is seen in premature babies. And also there is in some, if it is very early on, like for example maybe 28 to 32 weeks, if the premature baby is born, then there's also a chance of cerebral palsy. Cerebral palsy is basically a problem of like hypoxia. When there is less oxygen getting supplied to the brain for a long time, it may cause like permanent defects in the brain, like functions of the brain. So that is cerebral palsy, which also is one of the complications that we find in prematurity. So to sum it all, like respiratory distress is very important. Low birth weight, low immunity, high chances of infections, high chances of NICU and ventilator, necrotizing enterocolitis, retinopathy of prematurity. So these are the complications which we are trying to save when we are trying to hold a preterm, as in, just trying to delay birth in a preterm, in a patient who has gone into preterm labor.
Yeah. So, Dr. Bushra, we can say that if a preterm birth is happening, so it affects mentally and physically. Both ways it can affect the baby.
Both ways, yes, definitely. It affects the baby mentally and physically. Moreover, the kind of financial burden on the
Yeah.
family, the kind
Yes.
of burden that our healthcare system will have to, cater to the needs of a premature baby, and
Right.
the psychological stress also to the parents, because gynecology obstetrician, like, when you are an obstetrician, you are dealing with patients who are looking for good and only good. A
Right.
life is going to come into their life, I mean, in their family. It's not that, like, when you go for any other ailments to the hospital, you are going with a patient. So
Yes.
although you want good things to happen, but good and bad both are, like, inevitable. But for an obstetrician, we know that a family is waiting for a bundle of joy to come into their arms. They are not waiting for the financial and the psychological burden. So that is why also premature, like, to have a very healthy generation ahead, to try to cut down on the number of cases of prematurity is so important.
Very important, ma'am. Obviously, it's about the next generation which we are having for the society. So obviously, Dr. Bushra. So Dr. Bushra, what all means precautions there could be to so that a lady can avoid preterm delivery, or she should take care of herself, or what all is there? Just let us know.
Definitely. See, so how, like we discussed the risk factors of prematurity. So, like, planning the pregnancy at a proper age, not too young, and trying to like complete family, say before 35 years of age. To begin with, that is a very good step. If we are counseling the patients preconception, like before they are getting pregnant, we have to counsel them. We have to tell them to look into their, like, the hemoglobin levels, for example, vitamin D, vitamin B, all these things, and have a very proper nutritious diet.
Right.
If for some reason they are not able to have a nutritious diet, or are in deficient, like having a lot of deficiencies, they can have supplements. So one thing is to take care of when they are planning the pregnancy. Another thing is to take care of their nutrition, and during pregnancy, more importantly, to avoid any kind of infections and substance abuse. If you know that they are being exposed to, for example, smoking, or like people who are living in rural areas, so a lot of fertilizers, pesticides are some things which may affect the mother. Also trying to avoid infections, by not going in too many public places, avoiding outside food, and a lot of things, maintaining hygiene. So these are some factors. And another thing is that if they are having certain factors, like twin pregnancy, for example, or the water is more, which is polyhydramnios, or they have a history of preterm labor, so they have to be in touch with their caregiver, with their gynecologist. They have to give the proper history, and they might require few medications which will help to prevent preterm labor. A very important point which I would like to discuss here is, there is a myth in Indian society, especially our patients, who think that if they are being given medications to like withhold labor, because it is preterm and we are giving them medications to withhold that labor, what they think is that this will hinder their normal vaginal delivery even at term. This
Yes.
is the, by far, I think this is the worst myth which a person can have, because it has got nothing to do with a patient delivering normally, vaginally, or having a C-section. So my request to the patients is, please don't listen to, as in, the myths that are
Yeah.
going around. uh, just to think about, even financially, if that is what you are thinking, even financially, having a preterm baby is going to put you under a lot of stress. So might as well to take medications as far as it is needed till 37 weeks of pregnancy, and then whatever means of delivering the baby, whether vaginal normal delivery or a cesarean, will be good for you.
A very important point, Dr. Bushra, you have highlighted. This is very true and very practical, ma'am. That most of the patients, and more than the patient's family might be thinking that it's a kind of provoked C-section. It's a kind of जानबूझ के किए जाने वाला
Yeah,
C-section
exactly.
होता
And
है.
ultimately, the
But,
C-section comes later on. Initially,
yes,
what we are trying to do is just delaying the labor till the right time
correct.
comes.
Yes, yes. Thank you so much, Dr. Bushra, for giving us a lot of information on our topic today, preterm labor. A complete overview you have told, ma'am, and also along with what precautions has to be taken, what could be the complications, and how we can avoid it as well. So, Dr. Bushra, I would like you to, just conclude a session and please let us know what all could be the important point clinically which you find out and what message you want to give, to all our viewers about the topic today. And till then, I would request my viewers to please post any queries if there are. After Dr. Bushra's conclusion, we will take it up. Thank you.
So,
Please, ma'am.
firstly, I would like to thank Human Biologicals to take this so much needed this discussion on this topic, and I would like to conclude the session by saying that uh, any system, when it is in existence, our aim should be to decrease the the burden as much as possible, to have a very healthy future generation. Now, for that reason, knowing certain things about preterm is so important, reason being that once a preterm pain has started, many a times, more often than not, we will not be able to sustain it for a very long time. So here all we are wanting is to minimize the complications as much as possible. So for minimizing the complications as much as possible, we need a proper history, complete proper cooperation from the patient side. Sometimes what happens is, as I said, the most important complication of a preterm birth is respiratory distress, like the baby maintaining its oxygen on its own. So there is something called steroids which we can give to the mother at around 34 weeks of gestation. And after giving steroids, what happens is it helps in the lung maturity of the baby. Now, since if we are suspecting a preterm delivery, or if the mother shows up into a preterm labor and we are trying to stop the preterm labor, at least if we are getting time to give steroids and letting the steroids act, which is about 48 hours, 24 to 48 hours is required. Or for example, this is happening in some periphery, or even some small city which does not have very higher center for the baby, like the ventilators are not there or NICU is not there, and I want to shift. For example, I am in a small town which does not have like a very good NICU facility, and a patient is coming to me in preterm labor. I want to shift her to a tertiary care center, to some place like Indore or Bhopal, which will have very good NICU facilities. In that case, we can give some medications, at least to delay as much as possible. Not necessary that we will be successful in it, not necessary it will get delayed, if the patient might still deliver. So having a very sound knowledge, and from the patient side, I always encourage my patients to discuss each and everything. Like many a times we have come across patients who are not feeling their fetal movements, and they came to us with the fetal heart already stopped. So not feeling the fetal movements from their side was a very important point, which they did not pay attention to it, or they were told by their family members, oh, this is normal. So I always encourage my patients that nothing is not important. Like everything is important, or how much important or how much non-important it is, let the doctor decide. You have to say each and everything which you think is important enough that you could actually find it out, as in you could notice that change, then you should come and speak to your doctor about it. And to
Yes.
have these myths that not taking medications to stop preterm, or some certain things are very common in pregnancy, no, let the doctor decide whether it is normal for you or not. So ultimately, what I want to say here in preterm labor is there are a lot of things for which we can take a lot of steps only if they are brought to our notice on time. So to know the importance of these things and to discuss with your doctor does not hurt. It will To discuss it is not going to cost you money other than the OPD, of course, the consultation. So go ahead, speak to your doctor, be open about everything, and definitely we can try to like minimize the mishaps as much as possible.
Very true, Dr. Bushra. As you rightly said, let the doctor decide whether this thing is important to know or not. And obviously, this could be the mantra to actually stop preterm labors and everything. Thank you, Dr. Bushra. It's time to take some questions, ma'am.
Sure.
Uh, uh, Ma'am, Mr. Mani is asking that if one had a premature birth in the past, is she at increased risk of having a premature birth in another pregnancy? Means if
Yes,
once.
definitely, she is at a high risk, and the doctor should know about this history to give her proper prophylactic medications.
Okay. Ma'am, Dr. Akhila is asking that what is the role of corticosteroids in preterm labor and when it is given? Means you already explained about it,
Yes, I
ma'am,
did.
but
I did. It
when
is
it
the
has to be given could be.
yes, the definitely the role of corticosteroids. Most importantly, is in the lung maturation, and it is given. Ideally, it is given at 34 weeks, anywhere between 32 to 34 weeks of gestation. But if the patient is showing up, like maybe at 35 weeks, the patient is showing up and she has not had a steroid in the past, so I will give her steroids even at 35 weeks. I will give her medications to stop the preterm labor. And so anywhere after 32 weeks, either prophylactically I should give her beforehand, or when she is coming in preterm labor, at that time I should give her the steroids.
Okay. Uh, Doctor, we have another query that if a lady has preterm baby, then how to take care of that baby? Yes, if the delivery has happened, then
Yeah,
what to
yeah.
do?
So you should be considering yourself lucky if the baby goes with you. The baby, most importantly, more often than not, the baby goes to the NICU. So yes, the baby will go to a neonatal intensive care unit, and there, according to like the weight and how much the baby is able to sustain by itself, like sometimes only oxygen and warmer and things are required. Sometimes, if we are not lucky enough, then there's intubation, meaning like how we put adults on ventilator, so the babies are also on ventilator and they are on a number of medications, antibiotics, and everything. Now, most importantly, the if like supposedly if the baby is going with you, luckily, or after the hospital stay the baby comes to you, in a premature baby, a few very important things that you have to remember is try to avoid any and all infections as much as possible. Now for that, too many people, people coming from outside going and handling the baby, even hygiene maintaining at home. Then when you are feeding the baby, sometimes if you're not, mother's milk is the best. If the mother is not able to feed, or baby for some reason is not able to take the breast milk, and if the formula feeds are given, then formula feeds for premature infants are different. It's not same as the normal formula feed that you give to a term infant. So taking care of what formula you are feeding the child, maintaining hygiene, avoiding infections, and also trying to keep the mother as healthy as possible. So these are a few things which should be taken care of if while handling a premature baby.
Right, ma'am. Ma'am, there is one more query. You have already shared this, but are there tests to know the risk of preterm birth and which period one should go for it? Means willingly should a woman can also go for the tests? Might be this is the viewer asking.
Yes. Look, the test that I suggest, that I was talking about, the ones which we do, the chemical test for namely the PAMG one and all that. So that is done only once the preterm labor sets in. But there's the cervical length, as in the mouth of the uterus, which is called the cervix. When we are seeing the length of that, so if any lady has a history of premature births, then might as well that she goes for the to find the cervical length, and that can be done. For example, in the last pregnancy, the mother has delivered at 34 weeks, so she should go 1 or 2 weeks prior to those to that time, meaning the time of pregnancy in which the last delivery had occurred, like for example 34 weeks. Then might as well in this pregnancy she goes at 32 weeks itself. There is something called circlage. Circlage is putting a stitch, like manually, physically closing the uterus. So that can be done in patients who have a history of having preterm births again and again. So, if you have a history, then definitely you should go beforehand, talk to your gynecologist, and she will see the cervical length. Cervical length is one of the factors which can be done beforehand. Other factors are like other diagnostic tests, they are done once the preterm labor sets in.
Right. Thanks, Dr. Bushra. Ma'am, one query is like, I think you have explained the topic so well, so we are having lot many queries. We'll take up three, four more, ma'am, and then
Sure,
you
sure.
can also answer it online. So, one is which glycolytic is best?
Which tocolytic is best? There are so many tocolytics: isoxysuprine, ritodrine, etosaban, and every tocolytic has its own merits and complications, adverse effects, as you may say. So, by far, the choice of tocolytic is isoxysuprine, which is a beta 2 agonist, and that can be given IV, IM, or orally, depending on at what stage is the patient coming to you. Now, the complications are palpitations, like the patient will feel their own heartbeat, and it will be fast, it will be tachycardia. So, palpitations, tachycardia, low BP. So, if the patient has any heart disease prior to pregnancy, as in they have some heart conditions, or the patient is diabetic, then you cannot use isoxysuprine, and then definitely you have to go for some other like the tocolytic. So, by far, the choice of tocolytic is isoxysuprine.
Fine, ma'am. Doctor, one of our query is bed rest required to avoid preterm labor?
Definitely, definitely. Bed rest does have a role. Once if we are suspecting the patient might go into a preterm labor, or she's already showing signs and symptoms of preterm labor, bed rest does help a lot. Definitely, gravity is doing its work all the time. So, bed rest is
Yes.
definitely going to help you.
Thank you, ma'am. Also, ma'am, along with the tocolytics, one of our viewer is asking about magnesium sulfate role, if it
That's a
is
very good
good.
question.
Yeah.
That's a very good question. Now, magnesium sulfate in this thing, the protection from preterm labor, very early preterm labors, like some we can say maybe 28 to maybe say about 32 to 33 weeks, they may be helped with the magnesium sulfate. It's basically for neuroprotection. I think there's Miss Kandula Sumitra is asking this question, the
Yes, yes.
magnesium sulfate, and she has specifically written
For
neuroprotection. So yes,
neuroprotection. Yes.
yes, neuroprotection is one of the things, but usually that comes into play if it is a very early preterm labor.
Okay. Fine, ma'am. Also, ma'am, this you have already explained, but Ms. Dipali is asking that any specific changes that happen in a woman's body after the preterm birth of the baby?
After, no. After, I should
No,
say no.
no,
No, not
obvious.
after preterm. Yeah, there are definitely before preterm, but not after preterm.
Of course. So, ma'am, the queries till now were these many. So, if any queries further it comes, I will definitely come in contact with you.
Sure,
So,
definitely.
thank you so much, Dr. Bushra. Wholehearted thanks to you, on behalf of our whole Human Biologicals Institute team, as well as our initiative, which is puberty-to-menopause.com. So, thanks a lot, ma'am. It was
Thank
such a
you.
nice session and
Thank
such
you
a,
so much, Richa.
elaborative session with you.
Thank you. Thank
Thank you
you,
so
Richa.
much.
Thank you, Yaman.
Thank you, doctor. So once again, on behalf of Puberty to Menopause, a Women Health Awareness Initiative by Human Biologicals Institute, I wholeheartedly thank to all our viewers as well for being with us in each and every session. We request all of you to visit www.pubertytomenopause.com for more information on various health aspects of women at different stages of life. And follow us on Facebook, Twitter, Insta, and LinkedIn to get more updates on the health and live talks with the expert doctors across the nation. Till then, choose better nutrition, better life, and build your fitness. See you all again on our another interesting topic of health. Thank you so much.